How do you feel about the care you receive or the care that your loved one receives? And how do you feel about yourself as a patient? Are you finding it hard to speak up or fully understand or remember what you were told in your appointment? And when you leave your appointment, do you sometimes feel empowered and equipped to make healthcare decisions? Or do you feel kind of disempowered, like you had no say in your appointment? Do you leave your appointment feeling like you were rushed through and your provider didn't really listen to you? And were you able to address all your concerns and ask your questions? And if you asked your questions, did you really understand what was explained or the directions which were given? Well, and on your way home, did you think, oh my goodness, I didn't ask this question, or I didn't tell about this thing that's happening? Sometimes doctor's appointments are stressful, and we just aren't thinking at our best. They can be a source of life-saving help, but sometimes they're frustrating for both the patient and the provider. So let's address the ways that you can ensure that you get the most help possible from your appointments. And what we'll cover will also be helpful if you are an active participant in the appointment of your loved one that you're caring for. Now, in my career as a physician, I loved appointments that were fruitful and based on a solid partnership with my patient and their family members. But crafting and delivering exceptional care can be difficult because it's a fusion of art and science, and it uses a skill set that includes careful listening, review of medical history, detective work, assimilation and analysis of health markers, and the clues that lead to accurate diagnosis. It includes presentation of the diagnosis to the patient and a plan for further investigation or recommendations for how to proceed. The information is presented in understandable language with time for the patient to ask questions and express their own wishes and opinions regarding their treatment. Now, sometimes there are things that make it harder for doctors to deliver their best possible care during your appointment. And some of these things are not in your control, but some of them are in your control. And that gives you some power over how your appointment goes. Doctors face challenges, especially in this day and time. Appointment times have gotten shorter, not because the doctors may want them to be, but most physicians are employees of medical systems. They're under a multitude of pressures, including keeping their patient encounter numbers and billing high, documentation requirements, and record-keeping demands, and the ever-increasing work of staying abreast of the growing volume of medical knowledge. Your doctor may be allotted only 12 to 15 minutes for each follow-up appointment and be expected to document the visit on a computer either during a visit, between patient visits, or on their own time later on. These pressures are difficult, chronic, and many doctors struggle with burnout. They're also under the demands of third-party payers, the insurance companies, and having to deal with what they can and cannot do in their treatment planning. The good news is that in the midst of these pressures your provider faces, you can help them deliver their best care for you by practicing several strategies, which I'm going to share with you in this podcast. And in short, you want to prepare, focus, and partner with your provider. The goals are to support the best use of time, clear two-way communication, and a working partnership which is gratifying to you and your doctor. Remembering that even while you're a partner with your doctor, the appointment is for you. The doctor works for you. I had to kind of chuckle as I prepared this podcast thinking that it was about doctor's appointments. But isn't that interesting that in this country we consider it to be the doctor's appointment when actually it's your appointment with your doctor, who is your partner in providing you the best possible care and the best outcome possible for your health. Now, I can't begin to tell you how much your provider will appreciate your following these easy steps that we're going to go over, which will maximize the value of your appointments. So, ahead of time, prepare. Before your appointment, write down a list of the top 2 to 3 problems that you would like to address in your appointment. For each problem, note the nature of the symptoms, when they started, when and how often they occur, and what makes them better or worse. And rate how light or severe these symptoms are. Are they impacting your ability to carry on with your usual activities? Thinking through this ahead of time and noting it will help you remember things when you get into your appointment. And then write a list of all your medications and supplements that you take, both prescribed and over the counter. Some providers will actually ask that you bring all of your medications with you to the appointment. Pack your symptoms list, your insurance cards, and your vaccine cards. And some people find a dedicated notebook or binder or some kind of packet is helpful to keep all their things in. That can also be helpful in an emergency when you can just grab it and go. Bring something to do in the waiting room. A book, puzzles, or an activity on your phone. It gives you something relaxing to do, and it reduces stress. And the less stressed you are, the better you'll be able to participate. Then allow enough time to arrive at your appointment 15 minutes early in case you have delays or there's paperwork to do when you get to the office. Remember, if your doctor is late, it is most likely because they have been taking care of patients with emergencies or very complicated situations. They do not like running late any more than you like for them to delay you. Trust me on that one. And they will appreciate your promptness because it helps them stay on time throughout their day. Now, you're ready and your appointment time has come. Have your list at hand with you in the appointment and focus on the purpose of the appointment. Do not chit-chat. A pleasant greeting at the beginning is fine, but talking about the details of your fishing trip or describing your dismay about your favorite football team's losses eats up precious appointment time. Get to the appointment quickly. This is a working meeting, not just a social engagement. I once had a patient whose mother always prepared a written progress report for me before her son's appointments. She would tell me how he was doing, her questions, and whether he needed any medication refills. She would email her report to my office the day before his appointment. Now, at first I felt a little pressured by this, but I quickly grew to really appreciate it because it saved us time, it ensured that nothing was forgotten or passed over, and it enriched the medical record keeping. And it also gave her an opportunity to say things that she might not want to say in front of her son. I was in awe of what a strong advocate she was for her son, and I grew to really appreciate her record keeping and her ability to keep me abreast of the situation. It's also good to know how you organize and present your concerns and information is a big factor in how easy it is for your doctor to get an accurate picture of what's going on. So kind of the order that you give information in is either helpful or requires a lot more kind of gymnastics in the appointment for your doctor. You see, doctors are taught to organize and document medical information in a certain sequence. This helps them know where to retrieve needed information that's in the medical record, and it helps them process the information they're given. It also helps your doctor not to miss things. So no matter in what order you present the information, your doctor will take that information and put it in a certain order in their own mind and in your medical record. Now, if you deliver the information to them in their sequence, it is easier for them, and it requires fewer mental gymnastics for them. They can put more focus into diagnosis and treatment, and it saves time. So here's the order. Here's how to present your information. First of all, begin by stating the top concerns on your list. Now, here's an example. My main concern today is I'm not sleeping well and I'm feeling very tired. If we have time in this appointment, I would also like to ask about my blood pressure medicine and the ringing in my ears. Then that orients them to what you're going to be working on in that appointment. Now, they may want to add something to that, which is fine, but at the very beginning, you're just going to kind of negotiate with them what the appointment is about. Then the second thing is tell the history of the current problem with the related pertinent information. So when you're kind of in agreement with your doctor what you're going to talk about first, that you want to make sure you get covered, and that your doctor wants to make sure you get covered, start giving the history. So here's the example. I'm not sleeping well. I've been quite tired lately. Now, I fall asleep when I watch TV or read during the day. I don't feel rested when I get up in the morning, even though I'm going to be to bed early, and I notice that I'm occasionally waking up short of breath in the middle of the night. And on 5 or 6 mornings a week, when I wake up, I'm not rested, and I have a mild headache, but that goes away after about 10 minutes. This has been going on now for a couple of months, and it's almost every day and every night that these things happen to me. Now, at this stage of the appointment, your doctor is a detective looking for the clues that will lead to solving what is wrong. Your doctor will probably ask you questions to find more clues. Your answers to these questions will help clarify the diagnosis, so it is very important that you are as honest and precise as you can be. Stay focused and answer the questions to the best of your ability, and answer the question that they are asking. Even if you have to answer, "I don't honestly know," that's okay. Do not hold back truthful answers because of embarrassment or modesty. Withholding vital information sets your doctor up for possibly making an incorrect diagnosis and may mean that you will not get appropriate and timely treatment. Do not exaggerate. This is not a time to try to prove your point to make sure they understand you. Do not minimize. Honesty is crucial for your health and safety. Then, after taking history and possibly doing a physical exam, your doctor will give their opinion and or recommendation for a plan for further investigation or treatment. In this part of the appointment, active listening is key for you. Repeat what you're being told to make sure you're hearing it correctly and understanding it. Ask questions. And if you don't understand the answer, ask for clarification. It is the provider's job to explain it in a way that you can understand. If they're using words you don't understand, let them know which words are confusing. Remember, you are partners. They work for you, and you're partnering for your health. Now, If you're not in agreement with the recommended plan of treatment, speak up and explain your reservations. It's really important for your provider to know if they're recommending something that you don't want to do or that you're not convinced you can do it, or if it conflicts with values that you have or the direction that you want to go with your health care. That way you can talk it through with your provider and they'll know what your wishes are. They'll know, if you need extra help being able to follow through so that you can be more hopeful and have a way to be successful with the plan. Then finally, before you leave, ask how to best contact the office or your provider prior to your next appointment if you have questions, difficulty with the prescribed treatment, or if your condition is worsening. Now, sometimes it's hard to remember what was covered in the appointment. So here's some tricks to remembering what was said, and if you don't remember it, how to go back and retrieve the information. First of all, you have the option of bringing along a trusted family member or friend to provide an extra set of ears. If that's not an option or you don't want to do that, ask your provider if you can record the appointment, which is doable on your cell phone. That way you can listen to it again when you get home. You can ask for printed information sheets if you'd like to have a written record, especially if you'd like information about a condition you may have or a medication or instructions on how to proceed with your treatment plan. Many providers now provide a written summary before you even leave the office. That's really handy. Keep those summaries in a binder or file so that you can refer back to them if needed. This also comes in handy to show new providers your recent medical history and medication list. Many people have more than one provider, and if they're not in the same healthcare system so that they share an electronic medical record, if you bring the written reports to them, it's extremely helpful. Also, if you have an emergency and you're not able to give your own history, a relative with access to your binder can take it to the hospital for your medical team. So another kind of new development is you can now have access to your own medical records, including test results and the provider's notes from your office visit. These visit notes will have more detail about your diagnoses, your medications, your treatment plan, and your treatment progress and outcome. These are available through your provider's online patient portal, or if your provider doesn't have a patient portal, through another mechanism which your provider's office staff can explain. All physicians have this now, and by law you have access to it. Now, you can apply all of these methods when taking your care partner to an appointment. If you are legally their medical decision maker, include a copy of the medical power of attorney document in your binder to show to any new provider that you will be seeing. If you're accompanying a care partner who has dementia, allow for them to be included in the conversation as much as they're able to. Sometimes they may provide inaccurate information or deny problems, which can be a problem. So it's good to think through that ahead of time. And in that case, it's really helpful to prepare a written list of your observations and concerns before or at the beginning of the appointment. Pass that along to the provider. It's also helpful if you sit a little behind your loved one so that you can give the provider visual cues about whether their answers are really reality-based. So I encourage you to give these strategies a try. I'll bet you find that when you go to your appointments prepared, focused in and with an empowered partnership with your provider, you will be amazed at how your appointments will become smoother, less stressful, and more effective. And your provider will think of you as a rock star. They will be happy to see you come in. I guarantee it. It makes such a difference when people are ready and willing to participate positively and honestly in their appointments. If this has been helpful to you, please give us a like and become a subscriber so that you can be notified of new episodes. And if you're a caregiver who would like to meet with me to get personalized online help to protect your own health, click the Scissortail Health Coaching link below and request a complimentary online consultation. And do you have a particular topic you would like addressed on the podcast? Drop me an email. I would love to hear from you. Until next time, this is Dr. Corabell Arps on the Caregiver's Careport. Take care.